It is time for us to dive into our first career in healthcare, physical therapy. The team at Logan County Health Services in Oakley is here to help us understand why a day in physical therapy is anything but routine.
I truly love just the bond, the relationships that you make with patients. I love the fact that a patient can come to you in pain or hurting in possibly one of the most challenging seasons of their life, and you can help get them past that.
As a physical therapist, our treatment and our scope of treatments that we can provide is very broad. We treat in general musculoskeletal pain, so that would be your joint pain or your muscle pain, and then we can treat with a number of different modalities. We can help with the pain and the inflammation using machines and various applications with either electrical stimulation or ultrasound. But I think the crux of what we do comes with our exercise and manual therapy, and research supports that across the board. So we do, as a PT, I do a lot of manual therapy with my patients, such as joint mobilization or manipulation if it's appropriate. I do a lot of soft tissue work, a lot of cupping, what's called IASTM, or instrument assisted soft tissue mobilization. I do dry needling, and then I also will then follow that up always with exercise and individualized exercise programs that are important to that patient and address their specific needs to get them back to their best functional level as possible.
So primarily here at Logan County, I work in the hospital setting. So that is acute and swing bed care. And that is primarily with people 65 plus. A lot of times, the diagnoses can vary. Post-op care, just weakness due to general illness that puts them into the hospital. So we do a lot of functional activity, get the people back home, work them in the community so that way when they discharge from the hospital, they are set up for success, whether that be at home or in an assisted living, a nursing home, at home with family. We try to make everything as functional as possible so that way when they get home, they don't have to return.
A lot of times patients are fearful, patients are nervous about being in here. So a lot of it is connecting with the patient, forming that bond, letting the patient trust you. Like in terms of a shoulder, we do a lot of joint oscillations. So after you would massage the patient, you just simply rock their arm. You move their arm in order to get them to relax before you start moving. So a lot of it is patient trust.
Every day is going to be different, and that is one of the reasons why I truly enjoy it. It's a problem-solving job. I love problem solving. Every patient, again, comes in there different. They present differently. Some patients follow textbook patterns. Most patients do not. So if they're missing this piece of the puzzle, then what can I do, again, to make it individualized and to make sure that it meets that patient's needs in order to see that they can meet those goals and decrease their pain and get back to their functional things.
It is challenging. Like I said, you never know what you're going to walk into day by day, but at the same time, it is so rewarding. You see your patients progress, you see families excited that the patient is progressing after an illness that they weren't expecting. It is very rewarding.
I got a degree in health promotion and wellness, and it's a very broad degree. I did an internship at the Center for Health Improvement in Hayes. So again, very broad, working in a gym-like setting. My last semester at Fort Hayes, there was a girl that had expressed interest in going into the physical therapist assistant program, which piqued my interest, led me to apply there. And so that is ultimately where I ended up with 3 other of my classmates that also went into the same health promotion and wellness field.
So I attended Kansas State University and got a 4-year bachelor degree in kinesiology, and that left things very broad for me. I applied to the PTA program and got accepted, and it just felt like a good fit, and I knew I could work with many different people, many different settings, many different levels, and so that's why I chose that.
The education or schooling required to be a physical therapist requires that you undergo a 4-year undergrad degree. I chose my degree in athletic training. Some people will follow maybe a kinesiology path or just a biology path. Once that you have that undergrad degree, you can apply to go to PT school. Most physical therapy programs are 3 to 4 years in length, and they do include the clinical portion of the program within the content. So your clinical experiences are usually included in that program. After you graduate from physical therapy school, you will graduate with your Doctor of Physical Therapy, and then you are able to sit for your national board and become licensed.
It's a wonderful career. It offers challenges every day, but good challenges, but it's also very rewarding.
I would highly encourage a career in physical therapy. I feel like it has the ability to stay active all day. You don't sit all day or stand all day. You're constantly in motion. You're encouraging others to be active. And also it's changing every hour or every half hour that you have a patient. You see a whole new diagnosis. You work with an entire different person, different personality, different problem. And so and then you're constantly working as a team with the physical therapist. And so it's a really great environment.
If you like people, if you like to help people, if you like to problem solve, this is definitely a career path that would suit you. I think at the end of it all, if a patient's here for 12 weeks doing rehab for rotator cuff repair, a lot of times they get a lot of hugs just because we have established a relationship, and then again, living in a smaller community, see them out on the street, and it's just nice to know that you helped them out and that they were receptive to the care that you provided them.
My name is Samantha Teeter, and I am a PTA.
My name is Sarah Samuelson, and I'm a PTA.
My name is Holly Kuhlman, and I am a physical therapist.
I want to welcome our physical therapy panel to answer questions about this career opportunity. Joining us this morning from Logan County Health Services are Holly Kuhlman, Sarah Samuelson, and Sammy Teeter. Good morning.
Good morning. Good morning.
So I wanted to start off with a question about what the differences are in scope of work between PTs and PTAs.
Sure, Cindy. So the biggest difference between a physical therapist and a physical therapist assistant really kind of comes down to that first visit. So as a PT, I'll give you an example. A patient will come into the clinic and they have to be seen by a physical therapist. And during that time, seeing me, I would evaluate them and do some tests and measures with them that would look at maybe some range of motion or some strength issues or some gait issues, some walking issues. And then I take that information to then create what's called a plan of care, which is basically a fancy word for the treatment that I would like them to receive. So physical therapists design that plan of care from that initial visit. And then when a patient comes back to see us, they can be seen either by a physical therapist or a physical therapist assistant. And either one of us then can provide the treatment to that patient so that they meet their goals and that they truly get better. But that would be the biggest difference in what we do, where a PT has to start things, a PTA then can carry forward that treatment that the PT had established. There are a couple treatments in there that only PTs can do. Dry needling is an example of that. Manipulation is an example of that. But otherwise, we can all treat that patient to get back to their best health.
So that really helps answer that role of the PT and the PTA. Just a couple things that they don't do in that modality, it sounds like.
Correct. Wound care is another piece that falls in there, but that's a very specialized path that a physical therapist could go down. So,
well, thanks. So the next question I had for you was, does a physical therapist or PTA that works in the hospital do different type of work than someone who works in like an outpatient facility?
I would say that the work done in outpatient is pretty much the same work as an inpatient, but the population is different. In outpatient therapy, we see like a very vast variety of population, from anything as toddlers and kids to athletes to post-op orthopedic patients. And then also we also work with the older population. With the older population, we would focus on like higher level exercises or getting them comfortable doing an exercise program on their own. We also work on maintaining their flexibility and mobility, which is similar to the groundwork that Sammy works with when they are an inpatient.
Yeah, and touching on that, so inpatient, our population is more of the older population, so 65 plus is what we see a lot of. And we focus a lot on strength training, balance training, depending if they're in the hospital for a fall, or just a general illness that made them weak. We do a lot of community integration. So that way, when they are discharged from the hospital, they can have success back in the community, going to the grocery store, post office, doing their daily tasks. We also address home assessments where we can make or recommend modifications to their home. So again, when they leave the hospital, they can be safe when they return. And then a lot of times we do encourage them, once they are strong enough, to join Sarah in outpatient therapy.
Thank you. Well, I know we have students, like I said in the intro, we have over 100 schools and over 1,000 students listening today. So we want to hear from them. So if you are a student tuning in, use that chat feature to chat your questions and comments to our hosts and presenters. And at this time, I wanted to ask Jaron, what are the questions coming in from the chat?
Yeah, thanks, Cindy. So we have an active chat already. Several students and schools have already been putting great questions in there, and we encourage you to continue to do that. So one that will start from Jacob, you have good days and bad days in all jobs. What are some of the most difficult times in your role in physical therapy?
Yeah. There are patients that come in that are very simple and straightforward sometimes. So say somebody comes in with a knee injury. I would say knees as a general rule, and maybe even post-op total knees. We follow a pretty consistent protocol or just standard plan of care with those people, and they receive similar treatments one patient to the next. Then we get a lot of patients that come in that have a lot of underlying comorbidities, we call them. So they might have diabetes that we have, diabetes, or maybe some sort of neuromuscular condition, such as Parkinson's disease or multiple sclerosis. Those are also populations that we treat, and those are considered more complex patients. And so sometimes the treatments that we have to provide to them are more complex, and we have to take into consideration those other pieces and really just treating the whole individual. And that's, I guess, what makes it more complicated from time to time, at least for me. So,
yeah, and I would say on the inpatient side, people come into the hospital unexpected. They don't want to be there. And like I said earlier, it is the older population, and not every time do they get to return home. Sometimes they have to make adjustments into a long-term care facility or an assisted living, and that's really hard. And we try to provide emotional support to them as they have to transition to a different period of their life. So that's always tough.
absolutely.
Well, great. Well, thank you. Another one we'll go to from Lila. Do you have or excuse me, we'll do this other one. Where did it go here? Is the job hard for you to do mentally or even physically? And then maybe, I guess, what are some of those, kind of tying into maybe what you just answered, but what is that mental and physical impact, or is there one?
I would say as a PTA, it's a great job physically. It keeps you active, like there's documentation to do after every patient. And so you sit for maybe 15 minutes or stand at your computer working on documentation, because in this job, documentation is a huge piece in terms of reimbursement. If you're sending this to insurance for payment, you need thorough documentation. So physically, I feel like it's very rewarding. Typically, throughout the treatment, you're with the patient right beside them. There is times where you have to lift or teach body mechanics, which is also great pieces in teaching for patients moving forward. Mentally, I feel like it's a great job in terms of a challenge. You're working on understanding what the PT would like, and then also every treatment you're with the patient, you're working on how you can progress them to the next thing. Like you've mastered their gait pattern, they can walk again, but can they go upstairs? Can they start to run? Can they jump? And so piece by piece, it's a great challenge every day, both mentally and physically.
Great, thank you. Another will kind of combine into, a 2-for-1 here. What is your least favorite injury to treat? And then along those lines as well, are there certain types of care that are harder or more difficult to treat than others?
Oh, a least favorite injury. I don't know. So we live in a rural setting where we see anything and everything, literally head to toe, from concussions all the way to jaw pain to toe pain, wrist pain. I would say For me personally, if it's usually like a hand or an elbow, those are probably my least favorite, but I've definitely seen them. We are schooled and educated to take on really all of those pieces. If it was something that really required more of a specialization, then I would recommend that a hand therapist or an occupational therapist maybe take a look, because they do have a little bit more of the mindset for treating upper extremity conditions at times. So I would then refer out, or maybe even refer back to the provider and say, hey, we're kind of maxing out, or I need some other eyes on this. So for me, those two pieces there, but happy to see them either way. So, sorry, I don't remember what the second part of that question was. What is?
No, it was, you were kind of, I think, hitting it was, you know, just
Okay.
really, are there more that are there certain types of injuries harder to treat than others? But I don't know if anyone else had anything else to add to that either.
I'd say chronic pain is a
Oh,
little bit
yeah.
harder to treat. I mean, when people
Definitely.
have, a low back pain that they've had for years and years and years, you just don't see like as quick of progress, and you always hope to help everyone. But if an injury is more acute, I feel like we see quicker progress and
For sure.
and better progress. But again, like Holly said, we treat it all and we're trained to treat it all. So overall, it is all okay.
Another question, we might have time for, I think, a couple more here. The next one, do you have a lot of support from your family before you chose to do this job and during this job?
I would say yes. Like the field is very rewarding in that, I mean, you do leave a lot of work at work. There's HIPAA involved, which is privacy. So no patient's situations do you take home other than internally, but it is a great job. Like you see all sorts of injuries and anything from car accidents to sports accidents. And so it's good to be able to, your family knows what you do. They know you see, multiple patients in a day. And then the funniest thing is when people in the community talk to you, they're like, how do you know them? And it's like, don't worry about it. Like they know that you probably know more patients in the community than they do, but it's good. I feel like family support is huge.
I think too, with that, family support is huge. They definitely support, but they also, at least from my family, they like to take advantage of my skill set. And so I'm a PT on the job paid, and then I'm a PT at home treating my husband for his neck pain. It's just fun. It keeps us always up on our skills. So
There's never downtime, it sounds like.
no, there's not.
Well, so another question that maybe to show a little differentiation on, what can you explain the difference between physical therapy and occupational therapy?
Sure. Do you want me to take that? Sure. Okay. All right. So as occupational therapists, again, I kind of alluded to this a little bit. They can, in some settings, so maybe in an inpatient setting or a skilled nursing setting, we usually put just kind of a hard and fast line. Occupational therapists will see upper body. So sometimes your shoulder, but mostly elbow, hand, but they want to see the function of that particular limb. And then PT might take lower body and then gait training in those two settings, inpatient or skilled nursing. Otherwise, as a general rule, occupational therapists in an outpatient setting will treat hand, wrist, elbow, shoulder sometimes. Physical therapists will treat lower body, kind of the whole package, again, in outpatient setting. But when it comes down to function, occupational therapists are looking at how well you do what we call ADL tasks, activities of daily living. So how well do you get dressed? Do you put on your socks? Do you go to the bathroom? Can you get in and out of your home environment? They do a lot of our home assessments as well. Physical therapists will do more, again, just kind of gait training, general balance training, some of the lower extremity pieces. So I don't know if that clarifies.
Yeah. No, I think that's really helpful. And then I think we have time for one final question here, and maybe each of you can answer this one. What advice would you give to someone interested in pursuing a career as a physical therapist?
I feel like the biggest thing to start out with from high school moving forward into college is networking, making connections wherever you go, let people know who you are and the field, the direction you're looking to go. If you want to come back home after you go to college, like maybe get a job at your local hospital or somewhere around your hometown, and let them know that you're interested in coming back, making connections and meeting people so they have a face to put with your name when the time comes.
One thing that I like to tell people that come in and observe, or students, is make sure you like to talk to people. That's really important. We do get a lot of time with our patients, anywhere between 30 minutes to an hour. And so we learn a lot about them and hear a lot of their stories, and they hear a lot of our stories. So make sure you like to talk to people on a personal level. Make sure you like to put your hands on people and touch people, because you're going to be doing a lot of that. So those are kind of just two of the other factors of it.
Yeah, and I would say observe, talk to people that do this career. You know, we take students or potential students all the time in our clinic. They don't really need to have a reason if they don't want one. They can just come in and see what we do and join us with our patients. So I'd say get in there, get some observation hours, see if it's a good fit.